Hello everyone, the chapter that we're discussing, the concept that we're discussing now is called the dyslipidemia. A very good topic, a topic most of the general practitioners, physicians, and even all the setups people on the medical field come across. So, starting the topic, dyslipidemia. So, what are lipids? Lipids are sparingly soluble molecules that include cholesterol, fatty acids, and their derivatives. The plasma lipids are transported by lipoprotein particles. Okay, so lipids, they are sparingly soluble that include cholesterol, plus fatty acid and their derivatives. That is about lipids and how the lipids are transported in the body. So lipids are transported by lipoprotein. So a lipoprotein is a molecule, a particle that transport the lipids. Okay, so consider this is a particle, this is a lipoprotein, and that will transport the lipids. Okay, around it there will be lipids, like that. Next comes, what are lipoproteins particle composed of? Lipoproteins are composed of first one is apolipoprotein, second one is phospholipids, third one is free cholesterol, fourth one is cholesterol esters, fifth one is triglycerides. So think about this, a lipoprotein carry all the lipids, and the lipoproteins are composed of apolipoprotein, phospholipids, free cholesterol, cholesterol esters, and triglycerides. So all these components constitute a lipoprotein. The human plasma lipoprotein are separated into 5 major classes. So the lipoproteins are separated into 5 major classes. So what are the 5 major classes of lipoprotein? Before thinking about the 5 major classes of lipoprotein, you think what all constitute the lipoprotein. Of course, the lipoprotein are constituted by free cholesterol esters, triglycerides, free fatty acids like phospholipids, apolipoprotein, all those things. Okay, so the 5 major classes are, first one is chylomicron, which is very less dense, very momentalized, it's very less dense. VLDL, there is very low density lipoprotein, then intermediate density lipoprotein, then comes the low density lipoprotein, then comes the high density lipoprotein. These are the 5 major classes, considering the 5 major classes. 5 major classes. One more thing you have to remember, a sixth class has been derived, sixth class of drug has been of this protein has been derived, that is lipoprotein A, that is LPA, lipoprotein A, that resemble LDL in lipid composition. The sixth class is lipoprotein A, LPA, that resemble LDL in lipid compositions. So all these five classes contains these five components, that is apolipoprotein, phospholipid, free cholesterol, cholesterol esters, and triglycerides. Next you see the physical properties of plasma lipoprotein. We should be remembering all those things here and there. 90% of patients with coronary heart disease have some form of dyslipidemia. Increased levels of LDL cholesterol, remnant lipoprotein, and the lipoprotein A, and decreased levels of HDL cholesterol have all been associated with increased risk of premature vascular disease. Premature vascular disease. The main villain is these deranged problems or deranged lipid metabolism. So some causes like high LDL level, less HDL, increased remnant lipoprotein, and LPA, that is sixth class. So these are the main problematic conditions for causing premature vascular problem. The clinical dyslipoproteinemia, another condition. The clinical dyslipoproteinemia is very important. The lipoprotein, as we discussed, this is a carrier molecule of lipid. The lipoproteins transport lipids, and the lipoproteins contain different particles, and there are different types of lipoproteins also. So the most dyslipidemias are multifactorial in etiology and reflect the effect of genetic influence coupled with the diet, inactivity, smoking, alcohol use, and comorbid conditions such as obesity and diabetes mellitus. You see the differential diagnosis of major lipid abnormalities. We will discuss it soon. The major genetic dyslipoproteinemia are also we are discussing soon. The familial hypercholesterolemia and familial combined hypercholesterolipidemia. So we already told that certain groups, the lipoprotein composed of apolipoproteins, free cholesterols, triglycerides, phospholipids, esters, etc. So the major components are always triglycerides and cholesterols. So now discuss the drug. Let's discuss the lipoprotein. First one is the chylomicron. The chylomicron is the first drug, first lipoprotein. And in chylomicron, the compositions, we told that there are compositions. The major is the triglycerides, which is constituting 85%, and the next is contributing the cholesterol 3%, and mostly it is originated in the or intestine. You see the intestine. So that's about the chylomicrons. It also composes the lipoproteins also composes apolipoprotein, we already told. So what all apolipoprotein you can see in the chylomicrons? You see there are A1, A4, B48, C1, C2, C3, and E. These are the certain subclasses of lipoprotein which are seen along with the chylomicrons. Next comes the VLDL. The VLD is very low density lipoproteins. Among the lipoprotein, what all composition it has, the maximum is the triglycerides, that is 55%. And cholesterol is the 20%, and it originates in the liver. Okay, it originates in the liver. And what all apolipoproteins it has? It has B100, C1, C2, C3, E, like that. Okay, B100, C1, C2, C3, and E. So the total cholesterol, the triglycerides are higher in chylomicrons, and the triglycerides are lower in LDL, low density, high density. In LDL, why the LDL is called a bad cholesterol is because see why the LDL cholesterols are bad cholesterols. because LDL is a lipoprotein that carries the certain cholesterols, lipids in the body, and among that LDL the constituent is triglycerides and cholesterols. That cholesterol is higher in this group. That cholesterol is around 60% of cholesterol, and that can also collect in the walls of your blood vessels, raising your chances of health problems like a heart attack or stroke. But cholesterol is not at all dangerous. Your body needs it to protect its nerves and make healthy cells and hormones. Low level of cholesterol affects the immune system also. So what is this LDL? LDL, the apolipoproteins in the LDL. The apolipoprotein in the LDL is a B100. The apolipoprotein in the LDL is B100. Next is the HDL cholesterol. HDL cholesterol is highest density lipoprotein, and that carry triglycerides and cholesterols also. But why they are good cholesterol? Because the compositions of triglycerides and cholesterols are very less in this. They are good cholesterol because it helps remove other forms of cholesterol from your bloodstream. That's why they are good cholesterol. They're produced from the liver and intestines. Some subclasses like A1, A2, C1, C2, C3, E group of apolipoproteins. These are about the main content.
Thank you for listening. Have a nice day.